about stage of pregnancy, lactation, and older women. And then we also had a discussion on what are the important nutritional problems which people face with specific reference to women. And then we also try to understand what are the important nutritional programs for women and children. It was followed by our discussion on anatomy and physiology of reproduction and what are the common gynecological problems. Then in Unit 8, we also discussed what are the problems related with pregnancy, and there we were trying to differentiate between first, second, and third trimester, and also after pregnancy, which we call as postpartum. And then we also discussed about what are the important birth control methods. Again, major part of it is the onus of birth control also lies on women, common health problems of women, and we also had a discussion on how rural environment and urban environment is impacting women's health. What are the major healthcare systems in India? So we not only try to understand the major health administration part, but we also try to discuss about Ayush and important medical systems right from traditional medicine to the present allopathic medicine system. And then we had very interesting discussion in our innovative approaches in community health, where we said that technology is being extensively used as part of healthcare system in India, and we discussed several examples in that connection. And then lesson 15 yesterday and day before yesterday, we were trying to discuss the various health policy connected with women. And yesterday, if you can recall, we almost listed out all the important health related policies which is there for women. And in that Matritva Yojana we were talking, Janma Suraksha Yojana we were talking, and how health melas are being conducted to spread awareness and things like that. And yesterday we started about the last unit, discussion about the last unit, which was new economic policy, health and women. So yesterday we also saw a brief video, my dear friends, if you can recall, where we tried to understand that what are the major components of economic policy, right? And we saw a brief video of CNBC channel that how a lot of changes came in almost every domain of social living, and health was also impacted with that new economic policy. And we discussed that one very important component of the impact was privatization of healthcare. And then we also discussed in yesterday's class that how healthcare system is impacted by globalization. And this is a slide where we stop, where in an official government of India report in 1995, it was acknowledged that the new economic policies have put pressures on the citizens and women in particular, because several services which would have provided facilities to women, they were impacted because of the new economic policies. And this is where we stopped yesterday. Now let us continue our discussion, and today we will wind up our discussion of this particular paper, because we were given time from, like, I do not remember when exactly did we start our class. Just a minute, I will tell you when we exactly started. Sometimes your memory, some things which are very simple to remember, you tend to forget that. Right. So we began our classes on 22nd, my dear friends, 22nd of May. And today is our 12th class. And today we will be completing our discussion. Now, these are two very important studies which I thought I will share with all of you, which will also give you an understanding that how new economic policy was connected with healthcare and whether to what extent private sector involvement was there. So let us try to understand what is this to research about. So one research which was published in 2011 by Balarajan and others, what they are trying to say is that impact of new economic policy on healthcare and security in India, focusing on issues such as health financing, health infrastructure, and health workforce. The authors argue that new economic policy has led to increased private sector involvement in healthcare, but has also widened health inequalities and decreased access to healthcare for marginalized populations. Now, when we try to analyze this kind of research, my dear friends, what is very important for us to remember is that on a broader scale, somehow I feel that we have a kind of a negative perception about private sector. Most of the times we are under the impression that wherever private sector is involved, they are only talking about profit motive. But somehow I beg to differ from this. In fact, I'm of the opinion that in a country like India, there has to be a good balance of private sector and public sector. Why am I saying so? See, India is a welfare state. India's constitution clearly declared that we are a welfare state. As a welfare state, it becomes our responsibility to provide welfare schemes and policies for the different sections of the society, including marginalized groups, which include women, scheduled caste, scheduled tribe, minorities, our Divyangjan. So when you have to, or for farmers, there are so many policies, multiple dimensions. We have welfare policies. Now, if these policies have to be implemented, implementation does not happen free of cost. So the presence of private sector also is focusing on wealth generation. And this wealth generation is important to fund also the welfare policies. And that is why a good balance of both public sector and private sector is important. Now, we should also bear in mind that this research paper has been published in 2011. I am of complete agreement that the treatment in private hospitals is definitely at a higher end when compared to the government hospitals. But it is also a fact that government has identified hospitals, include private hospitals, where Arogya programs, Ayushman Bharat programs can be implemented. So there is a detailed list of hospitals. Some of them also include private hospitals. So such kind of hospitals also, if you have the Arogya card or Ayushman Bharat card, you can take the benefit of such schemes. So it wouldn't be right to completely say that, just because of private sector involvement, access to healthcare to marginalized populations has been effective. It is not the complete truth. And secondly, see, we also have to remember one thing that government's responsibility is multi-dimensional, right? So it can always regulate the pricing in the private hospitals and support the good quality healthcare process for the people of deprived sections. But irrespective of the presence of private sector also, we are seeing that on every individual, the burden of health expenditure is massive. That is definitely we have to agree. One more study, which was published in 2017 by Dandona and others, analyzed the trends in health expenditure in India between 95 to 2014. So even this is 10 years old research, what we are talking about. So the study found that there was a significant increase in out-of-pocket health expenditure and decrease in government spending on health after the implementation of NEP. This is very much right. To a great extent, this is right because you remember, as part of economic policies, we were expected to reduce the expenditure. Government expenditure had to be reduced, and you were liberalizing and allowing the entry of foreign investment in our country. So in this now, if a foreign company or a foreign hospital, like foreign chain of hospitals, is being opened in India, definitely they are not opening it for charity purpose, right? They will also make their respective margins, profit margins they will make. So, but again, the question is, to what extent they should be charging, and government should also facilitate a thorough regulation of such prices so that there can be balance, that they are not in loss. At the same time, middle class, lower middle class also is in a position to get proper treatment in the best quality healthcare environment. So the authors suggested that these changes may have negatively impacted the accessibility and quality of healthcare services for low-income individuals. So that is why, my dear friends, what is very important is, like when private sector is entering, okay, and they have a profit orientation, and private sector presence is in a way part and parcel of the economic reforms. It is part and parcel of your LPG schemes, right? So in such a scenario, what can be a good way to counter this and also help meet the poorest of the poor, best quality healthcare, is to strengthen the government healthcare system, strengthen the government hospitals. This is also happening. In fact, it is completely wrong to say that nothing is happening. Even that is happening, but again, not at that war footing level. But during COVID's time, we will see that, with specific reference to Telangana or Hyderabad, if you talk, Gandhi Hospital, which was a private hospital, that was the nodal center to treat all the COVID patients. So imagine many times the kind of mechanism and system what is there in government hospitals probably is not there in private hospital. We have to agree this on this point also. Of course, private hospital, if you're paying, you're in a position to pay huge money, of course, in terms of the additional facilities, allied services, they are provided. Now you take the example of NIMS in Hyderabad. It is also doing a wonderful service, right? Wonderful service, very well trained, very well experienced, and very good expertise of doctors is there in NIMS hospital also. So if we have to, like, if we are disappointed that, private hospitals are only making money, but they're also providing quality care. So if we have to counter this particular thing, the only way out is to strengthen the government healthcare system extensively. Then what are the other aspects? Reduced government funding for healthcare. This is one of the major outcomes of the new economic policy. Now, the reason is what? The reason was the government spending has to be regulated and boost private sector involvement in the economy. Increased out-of-pocket spending. So if government support for healthcare declines, individuals may be forced to pay more out-of-pocket for healthcare services. Overall health spending may rise as a result of this, but individuals who cannot afford, the same point what we discussed, increased focus on efficiency and cost containment. The NEP frequently included initiatives designed to improve efficiency and lower costs across a number of economic sectors. This might result in more attention being paid to healthcare cost containment, which might lead to declining overall health spending. So, new economic policy definitely had its pros and cons. And from 1991 to 2024, more than 3 decades has passed. And from 1991 till 2024, if you see, our lifestyles have undergone change, our spending habits have undergone change, our purchasing power has undergone drastic change. And all these things is also impacting our health in different ways, sometimes positive, sometimes negative also. But what is very important for us to remember here is, like, post COVID, a lot of awareness, and in the management of the COVID problem, even the government health infrastructure was strengthened to a great extent because a strong network of healthcare system was required. And so COVID taught us many lessons with regard to health sector, and from time to time there has been different health policies, national health mission, which I was talking yesterday. So even this has overall impacted the health prospects of the citizens and women in particular. Now, in this connection, it is also important for me to talk about national population policy. And what is this national population policy? You might be thinking, why am I talking about this as part of new economic policy? Because, like, first of all, this is there in our material, and economy and population are also connected with each other. Okay, and even uh, national population policy 2000 basically speaks about various aspects where there is strong mention about empowering women and ensuring the well-being of the community. So one very important component of national population policy is the postpartum intrauterine contraceptive device. The policy promotes the use of postpartum intrauterine contraceptive devices. These devices are provided to women immediately after childbirth. This is to ensure effective contraception and spacing between pregnancies. So this, we might get an impression that this is not directly connected with economic policy. But see, if uh, more and more women are working, women's involvement and participation in the workforce has increased significantly from 1991 to 2024. And now that recently government also came up with 33% reservation. So in coming days, we will see more and more involvement of women workforce more extensively and intensively. So in such kind of a situation, we cannot see women only in isolation and purely connected with economic prospects, right? So whenever you're talking about contribution of women in economy, definitely at a latent level, health of women becomes one important discussion, even if it is not in manifest terms, at least in latent terms, at a subordinate level, this discussion definitely becomes part and parcel of it. And let us overall try to understand that how economic policies have impacted health and women. See, one thing is for sure, and you all will agree with me, that drastic change has come in overall socio-economic system, cultural system, political and psychological aspects of Indian society after economics. No one can deny this. Let me share one or two examples, and then we will go ahead discussing the topics on the slide, the points on the slide. Now, see, when privatization was encouraged and our economy was liberalized, more and more foreign companies started coming to India. So that is where globalization got lot of impetus. It is not right to say that globalization is a new process in India. In fact, even in multiple phases of ancient and medieval India, we will see the presence of globalization as a process, but after 1991, the process has definitely accelerated, and this acceleration is also because of IT revolution. Okay, so when globalization has received so much of impetus, with the arrival of the foreign companies on Indian land, culturally also a lot of changes have taken place. Now, more, economy is expected to be more competitive, more vibrant, and this kind of a scenario, you have to also consider women's contribution and participation, right? Because women comprise of 50% of population. So if you have to make your economy more stronger, you have to overcome the cultural factors which was acting against the interest of women for a very long time, whether it was with regard to women education or women empowerment. Okay. So when globalization necessitated that women should actively participate and become a very, very active stakeholder in the entire economic process, women's education and employment became very, very important. Now, women's education and employment is possible only if the health of women is taken care and addressed. And because of various hormonal factors which we have discussed in the initial classes when we started this uh, classes, like initial classes, we said that so many hormonal factors impact the overall health of women. And with very, very strong presence of rural population in India, as close as 69% according to 2011 census. And in rural areas, the access to women's health is limited. Though a lot of effort is being going on, but the level of expansion is not as strong as it is in urban areas. So now please try to join the dots, friends. If we link women globalization bringing lot of cultural changes and overall LPG bringing more and more employment opportunities in private sector. So to fulfill the human resource requirement in the private sector, you require both men and women, right? You cannot ignore women. So that is how women's education and employment became very important. And if you want women to be educated, you want women to be employed and contribute her 100% to the economy, then her health also becomes important. This is the probably, if we have to articulate how new economic policy, health and women is connected. So one of the bullets of the articulation can be this also. This is what I'm trying to impress upon you. Then now when we try to understand that what all has happened after economic reform, so the analysis of the data reveals some interesting patterns in India's healthcare and public welfare spending over past 4 decades. Despite facing economic challenges and COVID-19 pandemic, government has maintained a consistent level of capital investment in medical and public health services. This is one very, very positive outcome, we can say. However, the percentage of revenue allocated to these sectors has fluctuated with slight decrease in recent years due to the pandemic. Pandemic actually impacted globally, like whole globe was impacted in terms of its economy, right? And conversely, there has been steady increase in spending on family welfare. Now, one very important component of women's health is family welfare and planning. See, when we were talking about birth control, when we were talking about birth control, probably we did not discuss this so much in detail that how much emphasis is being given. Now, earlier, family planning used to operate at a independent level. But now family planning has been merged with the concept of family welfare, because only when there is gap between the children, right? Only when women's reproductive health is good, women's overall health is good, children's infants as well as children's health is good overall, then that will definitely contribute to family welfare. And this was also strongly connected with, like, in case if you are implementing family planning, you are very, very conscious about how many children you want to have. And, it's a global slogan today, Chota Parivar, Sukhi Parivar. So if you have a small family, right, you are in a better position to invest money for the education of your children, overall personality development of the children. So in India, family planning over a period of time was merged with the concept of family welfare also. So today we call that as family planning and family welfare. So when we are talking about women's health after 4 decades of introduction of economic reforms and LPG schemes coming up, then what has Shruti, then what has happened is, uh, like, overall, it's connection between the economic policy, family welfare, and family planning. That connection gets established by default. So we have to remember one thing, my dear friends, that family wealth, whenever you're talking about that, that is the point I was trying to communicate. It just slipped out of my mind. That whenever you're talking about women's health, family welfare becomes a default part of it, and it is both advantageous and it has its respective gray areas also. Because again, when I say that, when I talk about women's health, family welfare becomes part and parcel of it, many people might object and they might question that why we cannot see women's health in isolation, why women's health should always be considered in connection with family welfare and family planning. But see, friends, that is how it is, because women is the natural caretaker of the child, okay, because she, by the virtue of the honor of her her ability to give birth to a child, she becomes natural caretaker of the child. And that is why you cannot always look at women's health in isolation. Women's health is one, definitely it is one independent category. I definitely agree with it. But again, you cannot completely isolate it from the entire ecosystem of family welfare. So I hope I'm able to make my point clear. And there is no rule that you have to agree with me on this rationality which I'm presenting. You can always have a counter viewpoint. You can always counter my argument also on this. This is what I have, my understanding, my point of view on this. Now, see, so we are conversely, there has been steady. Yes, this is what we were discussing. So, family welfare, there has been a better spending. This trend towards more investment in healthcare and public health initiatives is encouraging, as it could lead to improved health outcomes and quality of life for Indian population. So this is one very positive trend for that matter, right? And then gender sensitive. So this is very, very important. Whenever we are talking about development planning or planned economy, or when we talk about welfare policies, gender sensitive approach is very much required. So what is this gender sensitive approach? See, now, with regard to HIV, the point which is there in first point in our slide, when we try to address the concerns regarding HIV/AIDS, addressing this challenge requires gender-sensitive approach. Because culturally, especially with regard to sexual intercourse, sexual interaction, sexual partners, uh, right? All these factors is greatly influenced by cultural aspects also. So culturally, how woman as one gender, man as another gender, transgender persons as the third gender, how they are, looked at from this point of view, that is very, very important. So gender-sensitive economic and social welfare policies that protect women from slipping into poverty as globalization continues would also slow the spread of HIV. So basically, this point is with specific reference to HIV. And the reason why I'm exclusively talking about HIV, because in multiple cases, women have been the virus carriers. They have been virus carriers, if not directly responsible for that. So such policies include specific welfare provisions for female-headed households and increased levels of public sector investment in social services, such as primary education for girls and young women as a preventive measure. Now, when we talk about major health concerns for women, okay, so reproductive health, menstrual cycle, menopause, and things like that. And HIV is also one critical component. Now, with specific reference to reproductive health, and if I talk about HIV/AIDS, see, let us try to articulate how this is connected. Now, after globalization, when there was increased emphasis on women's employment, women's education, and schemes like Beti Bachao, Beti Padhao started coming up. So in such kind of a scenario, what happened is women women became also like ambitious in terms of their career. Their career aspirations improved drastically. Now understand one thing, that new economic policies which brought lot of cultural impact on Indian society, right? So because of this cultural impact, this cultural changes, what happened? The career aspirations of women improved to a great extent. Now, when women became career oriented, then probably she had a better role. Not in all cases, of course. She had a better role on decision regarding how many children she wants to have. So that is how family welfare, family planning, career aspirations, new economic reforms, they're also connected that way also. The cultural changes which was brought about because of economic reforms, the technological changes which were brought about, the political changes, the psychological changes, cultural change will automatically happen. And in fact, for culture to undergo change, also mindset has to change. Right. So all these factors, they operate in a ecosystem whereby women's health and economic policies get connected with each other. And um, again, with regard to reproductive health, sexual health, HIV/AIDS is one very, very important component of it. Gender awareness, women's participation and women's issues could be incorporated into development programs with the goal of deconstructing inequality. Now, many economists, they were of the opinion that after economic reforms, there were a lot of social inequalities. There were a lot of gender inequalities, which was propelled because of the economic reforms. So if you have to address such kind of inequalities and also keeping in view, I'm sure you all are familiar with the sustainable development goals, right? So to end all forms of gender violence, to facilitate gender equality, it is extremely important that more and more awareness is spread about gender issues. Okay, so greater greater emphasis on gender awareness, encouraging women to actively participate in political and economic dimensions. All these things will help us to fight the gender inequalities which has been existing due to various factors, including the historical factors, for several centuries. I wouldn't even use the word decades, several centuries. And in this connection, microcredit programs that focus on women's economic empowerment and that add business development services such as training, marketing, and technical assistance components are more sustainable and worthy of investment. So you have to now see, if I think you all will agree with me that if women is empowered, her prospects of she being aware of her health challenges and taking rectification steps becomes relatively easy. I think you all will agree with me on that, right? So if you have to make sure that empowerment is taking place, you have to focus on those opportunities, those platforms which will facilitate women to become economically empowered. And in that connection, microcredit is one of the important ways which will facilitate economic empowerment of women. And if women is economically empowered, she stands a better chance of better awareness about her health constraints. She will be more informed about how she can access different ways and methods of healthcare. So again, everything is connected, my dear friends. It's not that just because one economic policy was launched, it operates in isolation. It is not like that. It has impacted every aspect of Indian society, and women were no different. And in that, in particular, women's health was also. So we will now see one brief video, after which we will conclude our today's session. And I'm ending today's session with this brief video, friends. I hope you understood the topic, you understood the concept more easily, and probably videos played a very important role facilitating our better understanding about all these things. That is why it is very important. So first let me stop the screen share. And now I will share the video with you. It is loading, just a couple of minutes it will take. Yeah. Now let's play the video. It's a video of 3 minutes 36 seconds. So friends, I hope second. Yeah, so the purpose of starting this particular session with this video is there are three, four takeaway points in this. See, the entire paper, women's health issues and concepts. Of course, we are dealing with women reproductive health and general health problems. What kind of innovations have taken place? We are definitely discussing all these things. But simultaneously, what should be the key takeaway is if you are involving more and more women, okay, as part and parcel of community health leadership, where women get involved in direct decision making. They're also working in the ground level. So there is a holistic and better understanding of these challenges. And all those anonymous women health workers who are contributing so much towards entire community health, just not women's health, entire community health, they are playing very, very important role to improvise the healthcare access and quality in a country like India, where almost 65% plus population lives in villages. So I would like to conclude our session by saying this, that women's health issues are multidimensional. Over different age groups, women's health issues are there. There are serious challenges, but at the same time, there are policies which are evolving. Lot of innovations is coming. Lot of technological use is coming. Greater involvement of women in healthcare force is also happening. So, as I told you, and I told several times during our discussions, we have come miles. We should not think that nothing has happened. We have come miles and miles in our journey, and we are yet to walk little more mile to achieve the best desired results. And that is why it is very important that women are involved in decision making process also. That to a great extent will be able to address whatever remaining challenges are there. So there has to be a collaborative partnership. There has to be a gender sensitive approach. Friends, I hope that I could do some justice to this entire paper. I was given 12 classes, so I have tried my best that with whatever available time and available tools, I'm able to reach out to you to make sure that the contents become clear to you. Only thing is, I did not get an opportunity to directly interact with all of you. But I hope you all will do your best, and along with the material which you have taken, I also request you to refer online sources for your content. Very good online content is also available on the various topics connected with your course. So I wish you all the very best in all your endeavors, and I thank Department of Sociology, B.R. Ambedkar Open University, for giving me this opportunity to be associated with you. And I'm also extremely thankful to our host from B.R. Ambedkar Open University, who facilitated our online interaction on day-to-day basis. So all the very best to you, friends. Take care. Thank you all. Bye-bye. Be healthy, be happy. Bye-bye. See you all.